Hi, guys. Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. Today, we are diving deep into The Devil Wears Prada 2, specifically Emily Blunt. There have been a lot of red carpet appearances. She's been seen filming, and fans are noticing that she just looks different. So, we're going to dive deep. We're going to talk about what they are seeing that makes them think this, and perhaps maybe she's had too much filler or too much work. So I'm Dr. Smith, a board certified plastic surgeon, and one of your co-hosts. And I've got Dr. Amalfi with me up in Rochester. Hi, Ash.
Hey, well, first of all, huge fans of Devil Wears Prada,
We
right?
love Devils. Yeah, love that movie. So excited for the second. And
Yes,
I'm a big fan of Emily Blunt. So
I like
um,
her. I like her too. I mean, this movie was like pivotal for us. Like we grew up in this era. Like I would like to work in that industry if I didn't, have a cool job as
same.
a plastic surgeon.
I
Like
know. Of course, we would both want to do that.
we would over we would overlap there. That's what my daughter said she wants to be. That was like her thing last year. And now this year she wants to be a dermatologist. Both are cool. Yeah.
They're cool. We love that. Very,
Yeah.
yeah,
We're excited. We're huge fans. I never want to be like critical, but
yeah,
I think when people are chatting about things, sometimes it's a little bit demystifying if we talk about why and like what's going on. And I think that's what we wanted to do here. Like if you
yeah.
look at these pictures of her, she does look different and it's kind of almost like the width of her face that looks different. She looks like she's kind of puffed up or like overinflated. And a lot
Mhm.
of people say like that's overfilled, right? So like what are the specific things when you look at those side by sides, Smita, that you're
Yeah.
seeing that you think she's had done?
Right. Well, so I mean, I think the most important thing when it comes to fillers, which I think is why fillers in general just get a bad rap, is that you're not supposed to be able to tell that you have fillers,
Amen.
right? Like
Yeah,
you are
we
just
have
not,
fillers. You have no idea.
yeah. And like if it's done really well, sometimes we can't tell either, but um, it should not be noticeable. But things that we do notice and things that I think we're noticing when we look at the before and after photos is just the overall width, right? In if you look at younger photos, Emily is more narrow. She has a thinner face. Um, and in the current pictures, it's just, her face doesn't necessarily match her body, right? Because we know that
Yeah.
she's very fit, and when your face looks a little puffy or wide, that's sort of a sign for us that you've had fillers,
Yeah,
especially
it doesn't
when we're talking
match.
about the temples, the cheeks, right? Like there
Mhm.
shouldn't be a huge distance between the sides of your temples and cheeks and like your eyes, right?
Yes.
Um, and then the lower part of her face. So this is what I always tell people because when patients come in, and I'm sure they do this for with you too, Ashley. We see the signs of aging really in our lower face, right? We see
Yep.
like the jowling, the loose skin,
Yep.
everything looks
This
like it's
hanger here.
popping, right?
Yep.
And the reaction would be to treat this to
Mhm.
camouflage what's happening here. But that just makes the lower part of your face look very unnatural, boxy
Wide.
chin, wide, right? It
Masculine.
already gets widened because all of this stuff is now down here.
Yeah,
So
so
when
it
you
goes it
have a
goes
top,
from that triangle to like a square. Like you could almost make your skin do it.
you're right. And so what we don't want to do is add to that by adding fillers.
Mhm.
Um, and so unfortunately, I think in this instance, that was sort of done universally,
Yeah.
which is she just like the entire shape of her face is different, which I think is
Yeah.
what people are noticing, right?
Yeah. So lots of filler down here, some filler in her cheeks. And again, we all lose volume as we age. So a little filler in your cheeks is great. And it can look really, really natural, even in a tiny little face. And then a lot like sort of in this temple region and on the lateral orbital rim, it just looks unnaturally smooth, almost like a little alien like there. And normally you can see like the bony structure of our face. And when you start puffing things up so much that you can't appreciate the normal anatomy underneath, then it stopped looking human, and that's why it has like sort of that alien-y or like cat look or something like that because their skeletal shape is very different than ours. So you don't want to do anything so much that the anatomy is almost distorted. And so, I mean, plastic surgeons, are and dermatologists are, are the ones out there doing this. And but just because you're a celebrity doesn't mean that you're going to like the right person to get your work done, right? Like it doesn't guarantee that you're going to have a natural result just because you're famous.
Yeah. Yeah, and I think that's what, like, catches people off guard, and surprises
Yeah,
people.
they expect
They have
good
all
work.
the resources, right?
Yeah.
Like, all of the resources, they have the funds, they have access to the best of the best, but that doesn't mean you're actually getting the best treatment for you, right? And I think
Mhm.
we've seen this happen with celebrities over and over and over again, right? With Courtney Cox, with oh gosh, who was Kristen Davis, right, from Sex and the City, where you just have so much filler. And I think there's two things happening, right? Like once you have filler in place, you sort of reset what your normal is, right?
Yeah,
And
that's true.
right? And so then when you start losing some of that volume as the filler is dissolving, then you just keep on getting more because each single time you're resetting your normal to the point where we've lost like all sense of what your
We've
actual
expanded. We've expanded your
ex-
head.
right. And then going to somebody too, like it sort of is on both sides, right? Like you as the patient, you're seeing the deflation and you want more. And then you as the injector are like, sure, I see that, and so you really need
Yeah.
something to say no, right? Like
Yes. Yes.
you too much,
And
we have to solve it, start fresh.
but, like,
Uh,
the problem is, like, you're always gonna find somebody who's gonna take
yeah,
your money, and
right.
so, you don't wanna keep asking, like, if a surgeon, like a qualified board certified plastic surgeon tells you no, go home and, like, think about why that is. Don't go find someone else who's gonna take your money, because there's probably a reason that they're, like, putting a limit on there, and it's probably well within reason, and you
Yeah,
should kinda, take it
you should
seriously.
take it seriously. I mean, I always tell people, and I said no to someone yesterday, not about fillers, but about something else. But listen, we love doing what we do. We
Yes.
love making you guys feel confident and great in your skin. But when we don't feel like the procedure or the treatment is going to deliver that, then we're going to say no.
Yeah.
Um, but again, people will be there to take your money and they will say yes. And so just be careful. But that brings us to a good point. So, how do you find a good injector, right? What are some signs to look for?
First of all, credentialing, and we are huge fans of credentialing on here, and so we're always saying board certified plastic surgeon, board certified plastic surgeon. Dermatologist and facial plastic surgeons also very qualified to do injectables. Again, board certified in their specialty. And
Yeah,
remember that we are plastic surgeons. We're not cosmetic surgeons. That's not a thing. That is not a
good.
recognized board. We are plastic surgeons. And so you want to look for that. And I think that there's a lot of mid level providers, like advanced practice providers. So that means like physician assistants and nurses and um, nurse
Nurse
practitioners who are great injectors too. You just really want to look clearly at who trained them and who's overseeing them. Like, are they just, because when things happen and there's complications, you need a board certified dermatologist or a plastic surgeon to handle the complications. And so, do they have that? Like, or are they calling someone who's across the country, who's, owns their spa and signs a paper? Um, and so you really want to kind of ask those more clarifying questions to make sure that there's really someone supervising that person who's going to keep you safe all the time. And hopefully you never need it, but you just want to make sure that you know all of that on the front end. So ask and ask and ask a lot of questions. And
Yes.
then, like, I mean, I guess this is something we always kind of joke about, but like, how do you decide if the person that you're going to, Smita, is going to give you a look that you like or that's natural?
Yeah. I mean, I love this because we say this literally all the time. But I think if you walk into the office, right, and you look at the staff, you look at the doctor, the injector, look at like pay attention to what they look like, right? Because most often we treat our staff, and if they have an unnatural look, if you walk in and you're like, wow, everyone has a lot of filler, then you're gonna end up that way, right? Because
Yeah,
that is their
that's
aesthetic,
their
right?
look. Yeah.
Yeah. We all have, like, as plastic surgeons, as injectors, we all have our aesthetic. Ashley and I are, like, very natural, um, and less is more sort of thing, right?
Yeah.
And we like, I have filler in my face, we do injectables, so you want to look at who's injecting you, what everybody looks like,
Yeah.
and, make sure that matches what you're looking for.
Yeah, like, I saw a little meme that said, like, "If your plastic surgeon looks like an alien, you're about to look like one too."
Yeah.
So,
No,
yeah,
that's so
I
true.
mean, it's pretty clear, and I think that patients are a little savvy in regards to that, I really do. Like, I think they're looking at our social media and stuff, and they're seeing what our patients look like, whether it's facial, stuff or body stuff, and they're looking at results, and they're kinda gravitating to someone who caters to the look that they like. So check it out, on the credentialing side, but also on the results side, and I think it's pretty obvious, what you're gonna get. And then, if you don't like your filler and you get it somewhere else too, there are options to dissolve filler. It's not like paint and erase, but there's some things out there that we can do to kind of safely deflate what's been overinflated. But again, you really, really want a credentialed, qualified person to be doing that kind of stuff,
Yeah.
right?
Yeah, exactly. I mean, that's the thing, right? I think, because there are so many places, like, I mean, I'm right outside of New York City, right? Every block
Mhm.
has spa, dentist, like, everybody's injecting Botox, fillers, and you sort of forget that these are still invasive treatments.
Medical procedures,
For
yes.
medical procedures, and things can go wrong. And you want to make sure that you're in the safest hands, and they're able to address any of those concerns. So don't take it lightly. You know, less is always more. Again, the key to good fillers is for it to be undetectable, right? Like,
Yeah,
you should just look fresh and like you rested and you came back from a great vacation. But it should never look like you have fillers.
exactly. All right, you guys, that was fun. We love you, Emily Blunt and Devil Wears Prada. And if you wanted to inject you, we would. And make sure you guys follow along. We've got lots of fun hot topics heading your way on lipstick and lipo. So we will see you next week.
See you guys later. Bye.
Guys.